It brings me great joy to introduce Ayumi Sasaki, who's I've really enjoyed working with. She's presenting our team's work on informing an Indigenous digital health ecosystem through integration of social determinants of health and quality of life measures. Team members, please raise your hands. Who's in the room? So Ayumi is an amazing postdoctoral fellow here at Trinity Western University. She's also currently in the process of completing her doctoral studies in counseling psychology at the University of British Columbia. Her interests are in cultural and cross-cultural counseling. She is studying perspectives of living donor kidney transplantation among Indigenous peoples of BC. Thank you, Ayumi.
Thank you. Hello, everybody. I'm going to sit down for a little while. Since we're a little tight with time, I'm going to stick to the script a little bit closely here. So my name is Ayumi, and I will be presenting on behalf of our IDHE team at the Trinity Western University, and I'll be presenting on informing an Indigenous digital health ecosystem through the integration of social determinants of health and quality of life measures. In keeping in mind with the land acknowledgement from yesterday, we express our humble gratitude for our shared space and time today on the traditional, ancestral, and ceded territories of the Stewart people. Mestima Information Solution is a health and human service information management solution company. They are Indigenously owned and governed, and their services are used widely among Indigenous communities across Canada. Mestima is currently leading a consortium that is developing a new culturally aligned digital health platform that meets the unique needs of each Indigenous community. And this is where our team is currently working on part of this project, focusing on the integration of social determinants of health and quality of life information into the digital health system, the platform. So our research objective is to develop a social determinant of health, SDOH, and quality of life measurement framework that will help inform the system. We focus our questions into two areas. What are the relevant domain indicators and measures of social determinants of health and quality of life in Indigenous communities? And second, what are the recommended practice for use and digital integration of these social determinants of health and quality of life in the Indigenous communities? We applied an integrated knowledge translation principle to address the research questions from several angles. The first two were systematic reviews of the academic and grey literature in Canada, the US, Australia, and New Zealand. One was through Social Determinants of Health, done by Kathleen Lounsbury. The next was Quality of Life by Rebecca Stewart and Monica Friesen. And the third, we did a qualitative study involving Indigenous knowledge keepers and service providers that formed Learning Alliance table focus groups. There was a Delphi study that I will describe a little bit later on. Okay, so these are the figures from the findings from our studies. So the first is social determinants of health. Health and well-being encompass a broad range of domains that is distinct from colonial views of social determinants of health and quality of life. So here I focus on sharing kind of the underlying key principles and elements rather than describing these domains and subdomains that were found. For those of you who might be interested in reading further, there will be a QR code that links you to a handout that will share more of the research findings. So a key point that came up from the social determinant of health literature review is that colonization, racism, and discrimination cannot be examined as standalone and separate concepts, but rather permeate across these domains and subdomains, as depicted in the center of the sun, created by Kathleen. The Quality of Life literature review by Rebecca and Monica stress the importance of the interconnectedness and interrelatedness of all of the domains and areas of health and wellness. The gray center and the blue concentric rings in the figure represent a rock that is cast into a pool of water, creating a rippling out effect. They also emphasize that this finding also emphasized that the approach should be holistic and that it should be a balance of the physical, the mental, the spiritual and the emotional, and a need for a shift from a deficit-focused model to a strength-based model. These are the domains shared by the Learning Alliance tables, the Indigenous knowledge keepers, and the service providers. So in this figure, the underlying Indigenous principles are placed in the core of the circle and hold the health and wellness domains. The Learning Alliance table shared not only what, but also how these teachings are to be relayed and passed down, meaning that it should be relational, that it is done through gatherings, that it is experiential, that is through activities, events, ceremonies, and that these teachings are done orally through storytelling. So we are currently in the active process of weaving our findings together into culturally appropriate, relevant measurement frameworks. The key component of this was a Delphi study to reach a consensus. So what we did was we took our findings and created a list of items that capture some aspect of health and wellness, and then presented it to a group of Indigenous knowledge keepers and service providers and asked for their input and responses around what are the priority areas in your community with the aim to reach a consensus, an agreement among the participants. So the categories are, the analysis and weaving are currently ongoing, but these are the list of categories for which the items are underneath. They're not in any hierarchical or particular order. However, I would like to focus your attention to the two top points, connection to the land and policies of the land. Oh, good, we have some time, okay. So, for Indigenous people, health and well-being is very much connected to land. There's a strong tie here. We have our traditional lands, and for generations, we all came there to share. We have our own traditional ways of helping one another. We have our own ways of healing. This is a quote from a Learning Alliance table member. The physical, the emotional, the mental, and spiritual wellness and ways of healing are very much land-based and passed down through generations, the ancestors within that particular community. And this is echoed by Redvers, who describes Indigenous people's ontology, that is the way of being, and epistemology, that is the way of knowing, are intricately connected with land and country. Also reflected by a Learning Alliance table member who said, and that's part of ceremony, that's part of our connection with the Creator and our connection with everything on this earth and the elements. And those ceremonies are so critical. I have here a description of this conference from the website. Planetary health is a solution-oriented transdisciplinary field and social movement for addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. In our research findings, one of the key components that came up amongst all of our findings was the importance of the interconnectedness and interrelatedness of all of the different domains and subdomains, aspects of health and well-being. When there is a disruption in land, it impacts all other areas of health and well-being. So we think about the implications of that and the impacts that colonization and Indian residential school has had and continues to have on the land in itself. So this could be changes made to the environment, the resources, the ecosystem, the landscape, the climate change, and therefore all other areas of Indigenous health and well-being. So connection to ancestors, spirituality, tradition, language. In terms of planetary health, the Indigenous people's ability to preserve, to steward, to protect the land, we're talking now about sovereignty and ownership and control, plays an integral role for Indigenous people's health and well-being, and also to planetary health. So I'd like to acknowledged here with the Learning Alliance table members who have been part of this journey this entire time to support us, to share stories and teachings, to provide feedback and input of our results, and to also give some warnings on where to go, where not to go. So special thanks to Indigenous knowledge keepers, including Norma Rabbitskin and Lillian Underwood for their teachings, and also service providers for offering their candid input and feedback. So this QR code will link you to our preliminary findings, where you can read a little bit more about the domains, subdomains, and the descriptions. Thank you.
Methodological practices and getting through ethics review board, and just wanting to know if you were able to embed Indigenous ways of knowing into your ethics review and things of that nature. Yeah.
Yes, so in terms of the ethics, we are referring more for the qualitative study, for the focus group with the Indigenous knowledge keepers and the service providers in Indigenous communities. We have made sure to use storytelling as a fairly large part of our method. And the method that we use for qualitative analysis is interpretive descriptive analysis. So taking our findings, but also bringing it back to the focus groups and including that in our ethics to ensure that we are saying we will bring back our results to discuss with the focus groups, and also invite some of our research findings from Kathleen and from Monica at that time, but to our Learning Alliance tables to get their feedback and also to keep them in the loop of where we are.
So relations are
very much so. Mm-hmm.
And it was Indigenous led as well, right? That was probably an important part of ethics.
Yes.
Well, this was initiated by the Indigenous community.
Yes.
Yes. Sorry, I totally missed that part. Yes.
Thank you for that. Yeah, that's kind of an important ethical consideration. Any other questions? How will these findings be used, Ayumi? How do you envision the findings being used? For sure.
Yes, so Mastema is creating a new culturally aligned digital health platform that will then be placed into the communities for the communities to pick and choose what is important for them. How do they envision the community to continue on forward themselves? And so the information will be available here. We don't exactly know how that would exactly look like, but we do know that it would be very much owned and decided within the communities to see where they would like to take their to make decisions in terms of policies, in terms of funding, in terms of engaging everybody in there. I hope that answers the question.
Thank you so much.